So the glycemic index is a measure of how a food affects blood glucose response. There's quite a bit of evidence indicating that a high blood glucose response causes some tissue damage. And it is bad for developing type 2 diabetes and heart disease. So we have a lot of population studies. And when we look at populations who have a low glycemic index diet versus a high glycemic index diet, those ones on a low glycemic index diet have much less risk of developing type 2 diabetes or heart disease. So I think it's an important concept in terms of the healthfulness of a food. It's not the only concept, and it gives us a measure of the quality of available carbohydrate in the diet. Other important measures are dietary fiber, the healthy fats that are in the food. So glycemic index is just one measure of looking at the healthfulness of a food. So it would be nice in my mind to see the glycemic index concept put on labels for foods. It has to be done in a very intelligent way. We don't want it to be manipulated, but we want to inform the public to make healthier choices. And again, this is one way of assessing the healthfulness of a food. And it's important, obviously, for people with type 2 diabetes who have to control their blood glucose response, but it's also important for other individuals, healthy individuals, those who have a bit of extra weight on their stomach, because a lot of people will end up developing diabetes in the future. And I'm sure most individuals know somebody, a family member, a close friend, who has diabetes, and it's an increasing problem.